Welcome to the Nevin Economic Research Institute's latest episode of our discussion series. My name is Shauna Fitzsimons, and I'm joined today by Dr. Ivan Privalko from the Economic and Social Research Institute. And we're going to be discussing social inclusion and social risk in Ireland pre-pandemic and look at post-pandemic, kind of what's going on or during COVID at the minute. So thanks so much, Ivan, for joining us today. We'd love to talk about your recent work on decent work. Can you tell us maybe a little bit about the key findings of your most recent work?
Yeah, so our recent report on decent work took a human rights approach to group differences in work outcomes. So this report looks at who is working and the quality of the job that they have in Ireland. Specifically, we focus on the pre-pandemic period to kind of establish a baseline. And the hope is that it's a monitoring exercise. Every couple of years, we'll come back and kind of compare these groups and monitor them over time. So the report shows that certain groups are more likely to be disadvantaged in paid work, specifically younger workers, Eastern European migrants, people with a disability, and lone parents. And these people seem to be at a disadvantage for a range of outcomes. So in terms of who's actually in employment, we find that people with a disability are significantly less likely to even get work. So that group, their employment rate is about 41% compared to the national average, which is much higher. It's 73% in 2019. So that's a massive 32 percent point difference in that rate of employment for people with a disability. In terms of ethnicity, we also find really high unemployment among Black respondents and Muslim respondents relative to other groups. And one of the most shocking findings is that Irish travelers have really, really high unemployment, up to 80%. So that's 4 in 5 unemployed Irish travellers in Ireland using census figures. There's a bunch of different outcomes there that we look at, and at several of them, we find that there are key groups that don't stack up to the national average in terms of decent work.
And have the trends in these groups changed over time?
Yeah, over a period of labor market growth, so 2014 to 2019, group differences were kind of maintained, but employment rates grew for most of these groups, especially younger workers, non-EU migrants, lone parents, and those with kind of lower education. But like the differences between these groups seem to have persisted. Now, there are kind of gaps in this. So for Irish travelers, we don't have good data. We have to rely on the census, which occurs quite rarely. And that's the same for ethnicity. But yeah, we find that these kind of differences between the groups kind of maintain even when employment tends to grow.
Okay, and you mentioned, a decent job and decent work. What is a decent job by, the standards of the research that you're kind of looking at the minute?
Yeah, it's a difficult one to define. So there are a couple of indicators that we use, and we had if anyone is interested, check out the report. We had a consultation with lots of stakeholders, including NERI, to discuss exactly what we should be looking at, and we kind of arrived at a set of indicators. Um, so generally, it's difficult to define what a decent job is, and it differs for different people. So after this consultation with unions and NGOs and employers, we kind of focused on adequate access to work, adequate earnings, employee voice, and that means representation in the workplace and a certain level of job control in the workplace, work security, stability of work, equality of opportunity, and treatment in employment. And then the last one was health and safety. So based on kind of a set of indicators for those domains, we can say that if people have access to these things, they're in a decent job.
Okay. And can you tell me why, or, what's your understanding of why these groups are so maybe disproportionately impacted and maybe don't have access to the labor market or can't get access to something like a decent job? Why is there any kind of, or maybe pick an example of a certain group that stands out that why, what are the barriers that they're facing?
Yeah, there's lots of theories about why certain groups are excluded from the labor market. So, for example, it could be a human capital type of difference, and we try to account for those things in a lot of the research that we do. But for social risk groups, for example, which is kind of a set of groups that we typically look at in research. We tend to they're a set of groups that are limited in their access to the labor market, regardless of their class position, their resources, and other factors. So these include lone parents, older adults, the unemployed, people with the disabilities. They're limited in terms of how they can actually access employment and the extent to which they can participate in the labor market. So social risk groups are different from social class groups in that they offer additional explanations for the risk of poverty and social inclusion. So, sorry, to break that down a bit, these are groups that are kind of limited in the extent that they can of the time they can spend in the labor market and their general access to the labor market. So a lone parent, for example, doesn't have the same ability to invest as much time in a 40-hour work week as someone without children. And people with a disability are also, they're limited in the number of jobs that they could apply for, first of all, and then the experience of discrimination when looking for work could also play a part.
Yeah, and I can only imagine, even with, say, a lone parent, which I presume are predominantly female,
Yeah.
with the cost of childcare even. So, I know you pointed out maybe differences between people who have access to the labor market or the right not to work and a decent job and different things like that. So that obviously weighs heavily on someone who decides to return to the labor market or get a job, after having a child. It's very expensive, to afford childcare. So I presume that was probably a barrier for them to return to the labor market as well.
Yeah, and it's not just kind of childcare. So in general, when we think of social risk groups, we also think of non-work caring responsibilities. So lone parents definitely fit into that category. And you're right, the cost of childcare is a major barrier. But it can also be other groups, like people who are caring for a family member with a disability, people who are caring for older parents. We would consider them kind of a social risk group as well, and that they're kind of tied up with other things that prevent them from finding work.
So that kind of brings me to something like you mentioned social inclusion earlier on,
Yeah.
or social exclusion, maybe. Can you explain what that is exactly?
Yeah, so the roadmap for social inclusion outlines basically a set of goals. Social inclusion can relate to things like work. It can so people who are unemployed, we tend to think of them as in social exclusion, who are socially excluded. Income poverty is another form of social exclusion. So those people are prevented. People in income poverty are kind of prevented from living a normal life. Exclusion from social networks, so exclusion from community, family, and neighbors, can also kind of capture people who we would think of as socially excluded, and people who are excluded from from decision making and from adequate quality of life. So, yeah, the deprivation index, for example, captures a set of items that we would generally consider as being kind of crucial for having a normal life in Ireland. If people don't have access to 2 out of the 11 items, we would consider them as deprived and therefore potentially socially excluded. So there's a range of characteristics among people who are socially excluded, and we tend to focus on some of them in each research report. I should also say that the roadmap for social exclusion has like 7 major goals that they hope to achieve, and they range from extending employment opportunities to everybody who can work, to building more inclusive communities, encouraging active citizenship, stuff like that. So it's quite a broad definition of social inclusion or exclusion in that report.
And can you explain some of the problems that exist like there's not enough access to maybe decent work. So what does it look like? Like I've heard the term kind of working poor, where people are just working so much, but they're just simply not making enough to kind of, make ends meet and terms like that. So what does it look like? Or are there certain kind of key indicators of maybe like 0 hour contracts, that kind of thing, that kind of stand out, that these are the red flags, I suppose, that you're seeing of what it looks like at the minute?
Yeah, so importantly, the report on decent work focused mostly on pre-COVID, the state of the pre-COVID labor market. And the indicators that we use there, low pay, like you said, is very important. 0 hour contracts are very important. Job security is people who are anxious about losing their job. That's also an important indicator. But I think like the most important thing to remember in the report is that it's a set of findings that serves as a reminder for everybody who reads the report that it's not good enough to just have any job. It's important to have
Job, like you
a
said.
quality position that can be maintained over time. And what that means for different people will differ. So how do you help people find decent work? Obviously you rule out certain poor practices like 0 hour contracts, but then specific policies for certain groups are really important in helping them find decent work. The example that we use in the report is that some people from Eastern Europe would really benefit from finding good quality positions once they arrive in Ireland, rather than being left to their own devices in finding work. So specific activation for those groups, helping them navigate the labor market, maybe giving them English language training, maybe kind of explaining to them the pitfalls of certain work contracts. Those are all important in kind of capturing decent work.
Yeah, and
work.
yeah, no, absolutely. It makes total sense. And I presume there are kind of certain industries that this becomes quite prevalent in, like, and not even, it's quite broad. Like, it's not just maybe non-nationals coming in and getting, what we would rank as maybe quite low pay,
Yeah,
long hour jobs. Like, it ranges from, like going back to the lone parent thing, like healthcare workers or maybe female dominated industries, and that it's not just about the pay, that it's about, maybe flexibility. And I know it's come up again during COVID because, some people were very fortunate that we could work from home, but a lot of our essential workers, or what we now know as essential workers, they didn't have that option. So does that kind of factor in as well, like the type of work or this types of skills we need to do these different jobs as well? Does that kind of factor in?
I think the sector is really important, like you said. So, in another piece of work where we focused on migrants and COVID-19, we did find that, using kind of very limited data from the labor force survey. Again, the labor force survey was never designed to capture something as drastic as the COVID-19 lockdown, but it was a useful resource at the time. We were kind of curious to find, like, were migrants disproportionately affected by economic lockdown? And what we originally found was that, again, Eastern European migrants are particularly vulnerable to kind of losing their job, not being in employment, and then being absent from work because of COVID restrictions. Excuse me. And a major part of what explained that difference. So, human capital couldn't explain that. So it wasn't that these migrants didn't have the skills that Irish workers didn't have. Their education also didn't explain that. We controlled for a range of factors, but what really nailed down that difference between Eastern European workers and Irish workers from a similar background was the ability to work from home. The occupations and the sectors that really had home working as an option. Because for some reason, Eastern European migrants were really heavily reliant on these sectors that were disproportionately affected. That was the thing that really let them down when the lockdown happened. So things like hospitality, things like arts and kind of recreational facilities, they were really heavily concentrated in that sector. You can't do that work from home. therefore they were penalized when lockdown occurred.
And are there other, you mentioned the arts hospitality sector that was obviously, totally decimated really by the lockdowns. Were there other groups that are maybe higher represented, like the Eastern Europeans, in those industries as well, like young people maybe as well?
Yeah, look, young people were disproportionately affected by because they work in those sectors. And the interesting thing, actually, that this is a separate piece of work that myself and Dr. Bara Rowntree, were working on, is not only are young people disproportionately kind of located in those sectors, so hospitality, arts and recreation, um, the youngest generation is actually particularly reliant on that sector. So young people always worked in those sectors that were affected by the lockdown, but the most recent kind of cohort of workers from kind of born in the 90s, 80s and 90s, they were especially likely to be in that sector. So after lockdown happened, they were disproportionately hit by job losses.
And would I be right in assuming like this is also the same generation who were probably pretty heavily impacted by the 2008 financial crisis and have maybe just started recovering, maybe their early years coming out of like college, that kind of thing. We're probably pretty impacted by that as well. So this is a generation that, is carrying a lot of financial uncertainty and labor market uncertainty. What is the impact of that or the implications of, going through that?
Yeah, so we do find in that particular report that first of all, young people were disproportionately, those aged 15 to 34 were really hit by the COVID lockdown, and those aged kind of 35 and over were less affected by in terms of employment and unemployment. But we do find, yes, that also the NEET rate has actually gone up for those aged 20 to 24, so those not in education, employment, or training, and it's kind of surpassed the level that it was in 2007. So yeah, the two big shocks for young people, like you said, was the 2008 financial crisis and then the 2020 economic lockdown, and it's kind of affected. The previous shock affected young people in a way that their wages suffered. In that report, we show that the weekly earnings for young people has an age component, but also has a cohort component. So those born in 1980s and 90s, they have lower wages than older cohorts at the same age as them. They're also being pinched by the high cost of housing. They're in the rental sector. The price of rent is always going up. And then their capacity to own their own home is also much lower than it was in the past. So we find that the rates of home ownership for young adults have really collapsed, and they went from 61% at age 30 for those born in the 60s to just 32% for those born in the 80s. So as a result, there's an increasing number of young adults who are exposed to the private rental markets, where long-standing affordability issues have been exacerbated by the rise in rents. So they're being hit by a number of different factors there: lower wages, higher housing costs, less stability in work. And the COVID lockdown might actually have a similar effect to the 2007-2008 recession in that regard.
Yeah, and I suppose that's the thing. We don't really know what the the implications of are of that just yet. But I know, in NERI as well, I know Kieran Nugent has done some work on that of how the young people have been disproportionately impacted by the pandemic. And it kind of reminded me of the work that you've done with Dr. Barra Roundtree and the term the scarring effect, I suppose, because stood out to me. Could you tell me a little bit about what that is? I think you've just described it quite well, but maybe in more succinct words, could you tell me about that, the scarring effect? Because that was something when I read, I was quite shocked, that these things actually have a bigger impact on us, for, even, 10, 20, 30 years.
Yeah, the scarring effect is basically that well, this is really Barra's piece of work now that I'm kind of talking on his behalf, but the period that the period that economic shocks happen in can have an effect on workers independent of their human capital, their abilities at work, their investment in work, the sector that they work in, the occupation, lots of different things. And so, scarring effects can work in that wages stop rising, and those who are in employment, have a harder time negotiating higher wages. It can affect people in the sense that they lose their jobs, and long periods of unemployment can obviously affect your overall earnings. In that, time spent out of the labor market, affects workers in that they get less experience. And it can also kind of impact workers in the sense that they have to move out of certain sectors into other less, other sectors that they're not as that they haven't trained for, or that they have less experience with. So I hope I'm kind of summarizing it correctly, but in general, those are kind of some of the factors that can affect workers in terms of scarring. So big economic shocks, big cohort effects can have an impact on workers. Yeah.
Great, thanks so much. And just maybe to go back to kind of maybe a bit more of the findings of the decent work paper that you were part on with the ESRI. Like, what are the policy implications then for work like that?
Yeah, so the policy implications, like I said, is that it's not just about any job, it's about the quality of the work. The other thing to really keep in mind is that there are specific groups that really need help in terms of work. People with a disability, like we said, it's highly likely that the majority of those people want decent work if they can get it. But their employment levels are very, very low. So that should be addressed. What are the mechanisms that is keeping that group of people out of employment? And again, in terms of this trade-off of, the quantity versus the quality of jobs, there's a lot of debate about this. And at a very general level, the OECD comparative evidence suggests that countries with high employment rates tend to have high quality jobs and vice versa. So, it's not that pushing people into any job is going to help us grow the economy. What we find is that if we create good positions, good quality positions for everybody, that has a knock-on effect, and that it helps the economy grow as well.
And like you said, it's, the type of work, the industry that it's in, the flexibility to cover, because it's quite a wide group, it's like from migrant workers to lone parents to elderly people, people with a disability. Like, that's a very wide cohort, it's not just, one small minority, like it's a big collective of minorities. So they obviously have quite a vast number of needs that I imagine is a pretty wide net to cast. So there's probably an awful lot of work that can be done. Is there any kind of key suggestions there of what can be done in certain industries, maybe to improve the quality of the jobs, or like you said, the decent jobs or availability of decent jobs?
Yeah. Off the top of my head, I would have to go back and check the report, but I think, flexi time, one thing that we're finding is, the flexibility around working time can really have a positive impact on people with care obligations. And we find actually in a previous report that people with unmet care needs, unmet childcare needs, sorry. So these are people who are looking after children. They know that they have a need for childcare, but they can't, afford it, or the service isn't available. We find that those groups are especially likely to be in non-employment, and they're also especially likely to report higher levels of deprivation. So, flexibility in terms of, around work, I think, one thing that the COVID-19 lockdown has shown for people who can work from home is that, there is, people are as productive at home as they are in the office. And then the terms of flexibility of when work can start and stop can really have an impact. It doesn't have an impact on productivity, but it can really have an impact in terms of bringing more people into work. more part-time options, I think are incredibly beneficial for people with care obligations, but also maybe other groups like young people, for example, who can balance part-time college and part-time work,
Yeah.
would be very beneficial. So yeah, general flexibility at work, I think, is particularly important.
And I think, dare I say, that's one thing that maybe COVID actually did help us push the boundaries of a little bit more, was that far more people realized they could work from home, and far more people understood what it was like to kind of balance childcare at home and schooling and all these different types of elements. So maybe the one good thing to kind of come out of the whole pandemic is that maybe greater flexibility for people going forward, and hopefully it'll have an impact on, those who you discussed or kind of reported on from the 2019 the
Yeah.
decent work report. But yeah, look, thanks so much, Ivan. I don't know if you've any kind of final remarks or anything else you'd like to add, but I really enjoyed our chat and got a lot from it. So thank you so much for joining us.
Yeah, I think if I had to say one thing, I would just say that, the decent work report shows that there are important group differences. But the thing to keep in mind is that it's designed to track results over time. And I think that because it's established such a strong baseline before COVID lockdown, I think the next set of results will be especially interesting to everybody, including NERI, to really find out who those groups are, how the COVID-19 lockdown has affected people, and who are the ones that are most in need of help. So I look forward to seeing the next installment of this report anyway.
Yeah, absolutely. So do we. And yeah, thanks. We'll conclude there.